I'm so pleased to be sitting here today with Dr. Susan Bartlett, Professor of Medicine at McGill University. And at the center of her being is that of a clinical psychologist working with patients every day, as well as doing research with patients and with other rheumatology experts. I understand you're one of very few in the world that works specifically in the area of rheumatology, and we could not be happier to have you here with us today.
Cheryl, it's my honor really to be here and to be able to talk with you. I am fortunate. I have the opportunity and I have the time to sit down with patients and to be able to really listen to patients and to hear what their concerns are and what's important to them. But I also feel that it places me in an important position of advocacy, of being able to help other members of the health profession team to understand what's important to patients, why communication is essential to strong relationships, and how we can work together to be able to manage inflammatory arthritis as best as possible and let people live full and meaningful lives.
Well, I can't thank you enough for making that your life's pursuit. Patients like me are very indebted to our healthcare professionals here in Canada. So what can patients expect when being faced with transitioning?
Examining your own expectations is really important too, not just with biosimilars, with everything. Because it took a lot to get them in good control.
Right.
You don't get on a biologic unless you have moderate to severe disease. And your rheumatologist has probably cycled you through a number of different drugs before you got on the biologics and you got stable on the biologics. So of course you're going to be concerned. You should be concerned. I understand most people are going to be okay, but am I going to be okay? I want to continue to do really well. So that's the conversation I think that you need to have with your rheumatologist, and the only person who can really have that conversation with you is your doctor. I think they should also expect that they're going to pay more attention to how they feel, because that's natural and normal. Something's changed. Anytime something changes, we start to look at how it affects us. We start a new job, we look at how it affects us. We move to a new city, we look at how it affects us. Did I make the right decision? Am I doing okay? But as you begin to pay more attention to yourself, simply because you've moved on to this biosimilar, you're going to notice a lot of things. And the odds are pretty good that most of the things that you notice have absolutely nothing to do with the medication or even your RA, quite frankly. It's just kind of your body being your body. So in any given week, many of us will have a mild headache, we might have some stomach upset, we might notice that our muscles are more sore because we're holding on to some tension. When you start to pay attention to your body, you notice these things, and then it's what you say to yourself at that moment that really makes a difference.
How do I learn not to focus on the bad and remain optimistic? Is it just simply having a good understanding of the science, having a good trust relationship with my care provider?
I think it's all of those things. All of those things are important. I'll tell you what it's not. It's not simply trying to convince yourself, I'll be fine. He told me I'll be fine, so I'll be fine. That doesn't work with anybody.
Okay.
But let me explain a little bit about how placebo and nocebo actually work.
Okay.
So placebo is when you expect good things to happen, and they generally do with respect to changing a medication. And nocebo is the flip side of that. If you're worried, if you're anxious, you may have more trouble. And here's the reason why. Your expectations really drive where you set your attention.
I've certainly had those questions, and I've had the opportunity to have conversations with my healthcare providers, primarily my rheumatologist, which we've spoken before about the importance of that sort of first or primary conversation taking place with the rheumatologist. What does that look like? What does that conversation look like?
Rheumatologists, in my experience, are a special breed of physicians because they form relationships with their patients because these are long-term relationships. Our rheumatic diseases don't get cured at this point, they get managed. And so rheumatologists work with people over decades. And that's part of what brought them into the specialty. They're drawn to that. They like to have conversations with patients, and they really do love to see their patients thriving and continuing to do well and leading full and meaningful lives and letting that inflammatory arthritis fade into the background.
Right.
So this is all part and parcel of good medicine and what makes the therapeutic relationship so important and so strong.
Kind of gold standard. That might be a stretch, but if you could wave a magic wand and produce the perfect conversation, what would it sort of sound like? What would it contain?
I mean, there's something very important about a relationship between a patient and a rheumatologist because they know each other.
Yeah.
And they work together in ways that many other medical specialties don't need to work as closely with the patients. So for the patient to say, you know me, you know how long and hard we work to get me to where I am. Are you really confident that I'll do just as well?
Yeah.
I think that's a really legitimate and a very important question. And so how do you build your confidence and how do you know what you need to be asking? Mm-hmm. I think it varies from person to person. I know that there are some situations in my own life where if I was going to have a medical procedure, I'm not sure that I really want the details of the procedure. Yeah. On the other hand, if I was making a transition to a biologic, from a biologic rather to a biosimilar, I would want more information. So if you feel like you need more information, by all means, make sure that you inform yourself. And that's where I think that actually your materials are so incredibly helpful.
Oh, thank
because
you.
They're really aimed at patients and the information is very accessible, it's very high level, it's very high quality, but anybody can read it and anybody can understand biologics. And that's really important because you have to know what the questions are that you might have walking in.
I think that's important, especially when it won't be necessarily the doctor just voluntarily wanting to transition a patient. It will be a policy that will require them to for reasons of significant cost savings. So if someone is going to say, like for example myself, if I say, well, if it's less money, I think we sometimes think less money, less good. Mm-hmm. How do you overcome that?
Well, this is another reason I think that conversation is really important because you need to have a positive mindset moving into this transition. Right. And I think you need time to be ready mentally to do this. So you have to be able to find the information, up-to-date, credible information that you need and that you feel you can trust. You need to inform yourself. You need the opportunity to sit down with your doctor and ask the questions that you have. And then you need to understand what to expect. And I think, quite honestly, what you can expect is the very best possible outcomes.
Right.
All of the evidence suggests to us that almost everyone who goes on a biosimilar is going to do just fine.
So Susan, you've highlighted the important role and the conversation between patient and rheumatologist. What other supports are available to patients that will help lift up that conversation?
If there's a nurse, wow, you've got a very important ally and someone who really understands what you're going through and is a wonderful source of information and support. And in fact, in some of our clinics, what we find is that the nurses will talk with the patients first so they can then prime the rheumatologist. Here's what's really important to discuss with Mrs. Smith today. Pharmacists are also a wonderful resource, and pharmacists are highly trained in terms of how the medication is going to work. So they're an ideal source to turn to if you have concerns about might my reaction be different? Should I expect differences in the reaction site? How long might those differences last? So they're a very important source as well. Yeah. I think being able to talk with other patients is really helpful too.
Peer support, I agree wholeheartedly, obviously. That's my strong bias, clearly. But I couldn't agree with you more, and I think it's why we work hand in hand with expert health professionals like yourself, Susan, the rheumatology community very, very closely. And I guess that old adage is very true. It takes a village.
It really does.
Yeah.
And this is where we can all come together and help support patients. Yeah. And we know that there are things that we can absolutely do to help patients transition much more smoothly and effectively.
Yeah. I can't think of a better way to end our conversation than that. I want to thank you so much for the time you've taken to be with us. We appreciate your time so much, and equally so appreciate your huge expertise and sharing those insights with our audience.
And Cheryl, I think equally important is what you're doing for patients, just by having these kinds of conversations so that people can begin thinking about it, begin mentally preparing for it, and understanding what they can do to make their transition as smooth as possible.
Totally agree. Thank you.